COVID-19 is the biggest humanitarian challenge the world is facing today. It is unprecedented, and also this is ultimate uncertainty. If we look at this challenge in the second wave, it has been much more ferocious. This has impacted the entire family, both elderly and young people. Second point which was realized was collaboration between the central government and the industry, and also state government and the industry, to ensure continuous supply of medicine. The scientists have been working on the various medicines and also trying to understand the biological pathways. The concept of repurposed drug hence emanated, and the drugs which were thought that they are safe and can be tried to take care of this virus have been used. However, based on the further clinical work, we found out that they may not be totally effective. Hence, given the fact that the science is evolving, we have been trying to constantly find the solution to this virus. We used to produce 300,000 vials of remdesivir in the month of January and February. However, the cases started going up from second half of March, and the requirement of 300,000 of remdesivir was not enough. Remdesivir is a lyophilized product, and this product has got the production cycle of 3 to 4 weeks. We realized that the requirement has gone up, and the industry started ramping up the facilities from April onwards. In the month of June, the production of remdesivir went up to 10 million vials from 300,000 vials in the month of January. During the period of March, there was a shortage. However, this was taken up in the month of June, and July the situation is much better. Now, some of the drugs which appear to be promising is baricitinib of Eli Lilly and molnupiravir of MSD. This is a great time again of the collaboration. MSD has entered into collaboration with number of companies, as also Eli Lilly. This collaboration was also demonstrated in case of remdesivir, and Gilead entered into collaboration with number of companies. There have been some development in the case of cocktail drugs. MAB have been developed, which are being tried as far as cocktail drugs are concerned. There are also clinical work and studies going on, and one of the studies which has been undertaken is in Pune. We will keep on looking forward as far as cocktail drugs are concerned, as they have been able to reduce the impact of COVID-19 in hospitalized patients. COVID-19 is the greatest humanitarian challenge we are facing today. This is ultimate uncertainty. Whatever happened in COVID-1, there was big change in COVID-2, impacting the lives across the families and both young and old. There are three aspects of pandemic management. First is the testing, second is the tracking, and the third is the treatment. As far as testing is concerned, during the later part of COVID-1, significant emphasis was brought up in the testing. This led to better containment strategy and tracking of patients. Based on COVID 2.0 learning, we also started building a genome testing facilities so we can test the virus, and we have been able to find Delta variant, and now there is talk of Delta plus variant, and there may be new variants which are evolving. Testing and tracking will help us to focus our attention on the better management of the variants. The third part, which is very important, is the treatment part. Treatment consists, based on our learning of COVID 2.0, is availability of oxygen. There has been ramping up of oxygen facilities in different hospitals around the country. Second is the availability of ICU beds. Again, significant amount of work which is being done, and the Government of India has recently announced the package of rupees 23,000 crores to build up both oxygen facilities as well as ICU facilities, and also medicines. If we see the third part, which is medicine, there has to be inventory management of raw materials, finished goods, which are critical for COVID management. Also, the stockpiling has to be done at the government level. Beside availability of the medicine, the patient should be also aware where the medicines will be available. Hence, the helpline system becomes important both at the company level as well at the government level. If we work on this, we will lead to the better management of COVID unprecedented situation.